Welcome to episode number 9 of Integrative Approaches to Mastering Wellness. I'm Santhi Kanikella, physician and life coach. So life's been a little bit hectic lately, so I apologize for that. But I have some fun things to report and interesting things to report. I recently went to San Diego for the Academy of Integrative Health and Medicine's National Conference. There were just so many exciting presentations surrounding the areas of whole health, mental health, and bridging gaps in our current practice of medicine. I felt truly privileged this year to be able to present alongside these amazing speakers. I spoke about mind-body therapies and its connection to life coaching, all in the context of physician burnout and clinician burnout. And some of you may already feeling it. I guess whether you're a patient or a healthcare worker, you're feeling it, right? Like that crunch, the lack of time, the lack of resources. I just wanted to spend a little bit of time shedding light on that, really, because I think it's easy to blame the provider from this standpoint for physicians. We're really kind of falling into a healthcare crisis. Part of it is due to burnout. Part of it is due to the way the system is set up and how it does or does not support its employees and how it does or does not support its patients. So just to take a moment to talk about burnout, people are starting to phase out the term burnout, which I totally agree with, and I'll go into that in a second. They're phasing it out and they're starting to call it moral injury. And I'll kind of clue you into why. So when we talk about burnout, we're talking about workplace-related stress and how it's associated with physical and emotional exhaustion. It can also be accompanied by a decreased sense of accomplishment and a loss of personal identity. Again, not very uncommon amongst healthcare providers, unfortunately. I like the term moral injury better because actually it's less blaming. So when you think of burnout, you think of the person who has the burnout as being the problem. Like, well, if their coping skills were just a little bit better, or if they meditated more, they would be so much more on top of it. Like, no, maybe there are some personal factors at play, but certainly when it comes to the healthcare system, there are systemic issues there that need to be addressed in order for the whole to function normally and optimally, I should say. So let's take that for what it is. And just for a moment, hold some compassion for the people that are working in medicine right now. It has not been easy these past few years, especially since COVID came about. Even well before COVID, over 50% of physicians and nurses were already experiencing burnout. But once the pandemic hit, actually up to 63% of physicians had reported burnout. So I want to close by saying this. While burnout and moral injury are ever present in today's practice of medicine, I do know that this is something that also exists in other industries. So if you've gotten this far in this episode, please do your friends and colleagues a favor, share this episode with them. My mission is to be able to bring awareness to this issue so that we can move ourselves forward in a global way. I want us to be able to move towards healing and being able to create solutions for this problem that are sustainable. So hop onto my website at imwellmd.com. You can click on my picture there and join our mailing list. You can also become a member of our Facebook group, Integrative Approaches to Mastering Wellness. There's a private physician group if you ever feel like you just need a safe space to be able to speak. We really need to band together as a community because together we can rise. Until next time, be well.